Hello everyone, welcome back to my show, NainaMD, Fusion of Science and Beauty. This is Dr. Naina. I'd like to welcome my next guest, Dr. Stephen Ross. He practices functional medicine. He's also he's a chiropractor medicine as well, and also he's the president of the Advanced Medical Academy. Dr. Ross, tell us a lot about, I know your passion has been to educate and to start education programs in integrative medicine and the proper way of integrative medicine. By that I mean how we are arriving at conclusions in integrative medicine in an evidence-based manner. So please explain to us what it is that you have taught and what you've discovered along the way.
Well, thank you for having me here, first of all. I appreciate that. As you know, functional and integrative medicine really is the future of medicine today. And as much as I talk around the country about the new paradigm in healthcare today, I think that paradigm has shifted. I think we have reached that tipping point. And that is because there is a demand for a new type of medicine. And that's where we get into functional and integrative medicine.
And I think we need to explain what that tipping point is, because people no longer are looking for the quick fix.
Correct.
Right?
Right.
We know that conventional medicine is wonderful for treating acute. You get in an accident, you got to go. You have to have a surgery, you have to, it's wonderful.
Right.
But every day, complaints, fatigue, or my gut hurts, or my stomach hurts, or I've got a headache all the time, or people don't want to just be given a medicine, right?
That's right.
They want to know, well, what is it that's really going on? Why can't I get over this?
That's right, and I think you'll agree with me that you see patients coming into your practice every day now.
All the time.
Saying, doctor, I've got high blood pressure, my cholesterol's out of range, I've got diabetes, I'm tired of taking all these drugs. What can I do to reverse it and prevent it from coming back in a natural method? And that's where functional and integrative medicine comes in. And the science behind it is there, and it's been there for many, many years. And
I started this, 20 years ago?
Right, and I started
with the science behind it.
Right, 30 years ago for me.
Yeah,
so I know it's there, and the patients are demanding it. That's why the demand has gotten so high lately, because the patients are requesting something different. And if you don't have something different, they're going to go find somebody that does.
Well, I think also they're a bit confused because they go to the conventional doctor and he tells them one thing. They're going to another doctor who doesn't practice functional or conventional medicine, and he tells them something, and they don't know where they stand. And then suddenly their disease gets worse, and they get scared and say, okay, I'll just go on the medicines because I just don't know any better. And this is part of the shows, is to create that awareness. Part of the anti-aging or regenerative movement is to really, I don't feel any anti-aging physician without the knowledge of functional medicine is credible, honestly.
Right.
So define functional medicine, because I know what it is. I participated in the it's functionalmedicine.org, which we started that whole Institute of Functional Medicine. My mentor was Dr. Jeffrey Bland.
As was
you remember?
mine.
Yep.
Yes.
And I was very fortunate to have been trained by him under his wing, so to speak. But explain to the audience, what is functional medicine?
Right. Well, functional medicine is really learning how to get to the root cause of the health challenge. In past healthcare, it's all about finding the diagnosis. In functional medicine, it's getting to the root cause. And we do that by doing some highly specialized laboratory testing, whether it's looking at your hormones, looking at your blood levels, looking at urine for neurotransmitters, or whatever it might be, because we're looking at the basic physiology of the body. Why aren't you functioning properly? Why did you develop this disease in the first place? And once we find out what that fault is, where it happened to start, then we can treat from the root cause. Right. So it's all about the root cause. And we can treat from a functional perspective, whether it's nutrition, nutraceuticals, hormones, whatever it might be, to help rebuild the body.
And I think it's important for the audience to understand also that we don't wait for a disease state to appear.
Correct.
So when we treat the root cause, is you really look for imbalances and you treat dysfunctions. There is now in functional medicine and integrative medicine, it is very logical for us to treat dysfunctions.
That's
right.
We're
not waiting for a disease process and say, okay, you've got high blood pressure, but high blood pressure is actually inflammation in the arteries. So we're able to predict that through a blood test or perhaps other testing that we do, and we say, well, if you've got this much inflammation in the arteries, if you don't do something, you will. That's one of the things you can go on to develop. But let's treat that imbalance. Let's lower that inflammation in the arteries, and then we'll recheck that blood test or a couple of other parameters that we use, and then that's how we treat. So we're looking at dysfunctions. It's so important to understand that.
It is, and that really is true prevention medicine.
Yeah.
You know, for years we've looked at preventive medicine as getting your cholesterol checked, getting your blood pressure checked. Well, that's a disease state already. So like you said, we're looking at true prevention.
Yeah.
And we can predict things happening before they happen as well.
I think, though, people think preventive medicine, though, is more like, okay, when should I get my measles, my mumps? When do I get my mammogram? When do I get my pap? When do I get my colonoscopy? So those are really, that's really what preventive medicine is. There is especially preventive medicine, but that is really what it looks at. So we have to define integrated medicine. Prevention is really treating the dysfunctions and looking for dysfunctions.
That's right. That's right.
So it's two different things,
right,
but yet the same name. So that's also creating the misperception out there.
Right. There is a misunderstanding.
There's a misperception. I think the other thing too is just very important is to say, look, what are the optimum values of blood tests? So patients are so often will come to see me and they say, well, my doctor said everything's normal. But I'll look at the same set of blood work and say, no, it's not normal. It's not all normal. And then I have to go on and explain that there are something known as optimum values. For example, you have a range, right? Let's just say there's a range of like, I'm just going to say throw something out there, like serum ferritin, the amount of iron stored in your bone marrow, okay? Like a 10 to 290. Well, that's a huge range.
Right.
So they just took 100 people basically at random, the lowest to the highest. Forget they didn't know that they were having symptoms. Just that's the range.
Right.
So
and in a traditional point of view,
in the normal, I mean that's how.
In a traditional point of view, if you're 290, you're normal.
And if you're 11, you're normal.
Right. So in functional medicine, we take these ranges and we bring them, we squeeze them down quite a bit. And even if it's high normal optimal or low normal optimal, we're still asking the question, why?
Yeah.
Why can't we be more in the center?
Yeah.
And that's really important.
And also in some cases, some patients actually, we just shift in the normal range. So our medicine is based on saying, okay, maybe you were in the center of this blood test, but we shifted you to high normal and your symptoms suddenly resolve. Or we shifted you to lower and your symptoms resolve. So I think it's very important to explain to them, to the audience, that the way that we interpret tests is very different. Yes, we do specialized testing, but we could interpret your same blood test and look at it very differently.
The interpretation is different, and also our goals are a much tighter parameter.
Yes.
And that's what makes the big difference. So it's really an art when it comes to it. We're looking at all these values, and we really want to get them all balanced.
And the third important point I think of functional medicine is that it's not compartmentalized. Everything is interrelated, right? So we're looking at imbalances like gastrointestinal imbalances. That's just the stomach stuff, right? That's the gut, colon, all of those things. Neurotransmitter imbalances. We know that we have neurotransmitters in our brain that tell us or get up and go neurotransmitters, and then we've got our transmitters make us feel kind of like relaxed. So neurotransmitters. We've got immune system imbalances, environmental toxin exposure. We look at all of this. We look at hormone imbalances. We look at something called mitochondrial dysfunction. Will you please explain what that is?
Right, mitochondrial
that's my favorite.
dysfunction.
That's my favorite.
That all comes under the heading of adrenal dysfunction or adrenal exhaustion.
Which we're going to talk
in another segment. So
many
people have problems with
that today. We're going to get you back on the show for that.
Mitochondria are those little energy bundles in every single cell in the body, and that's those little energy bundles that produce what's called ATP.
Which produces the oxygen, right?
Right. So many people, when they get into the state of exhaustion, actually are exhausting the engine. They're causing dysfunction of that mitochondria that we like to call the engine that produces.
And things that can disrupt it is like toxins, like mercury and all these toxins.
Environmental toxins. Toxins from your food, toxins,
medicines,
stress too can cause that,
everything,
which is another toxin.
Yeah. And I think so going back to that, so it's not compartmentalized. Everything's interrelated. So when you fix one system, suddenly maybe another system can get fixed in functional medicine. Suddenly the patient will say, well, there's a gut-brain connection. You fixed my gut, but then I'm less I don't have the anxiety, my depression disappeared.
Right.
Just
Isn't
by
that
fixing the
funny?
gut. Isn't that funny? I've done that so many people
Right.
now.
80% of our immune system's in our gut,
Yeah.
and most people don't realize
exactly. So in conventional medicine, it's compartmentalized. Okay, go to your cholesterol is high, you've got a risk factor, go to the cardiologist for a stress test. Okay, you have a rash, go to the dermatologist.
Right.
But nobody's sitting there, well, maybe this person had the rash and has got the cholesterol issue and has got this immune system issue because the hormones were declining and causing an immune system imbalance. Or, no one's thinking
A affects
that way.
B, which affects C, which affects D.
Yeah. So
It's like the old saying, the knee bone's connected to the hip bone.
You got it.
It's all connected.
Yeah. And I think the last thing about functional medicine is that we need to understand that when we give, it's sort of like one medicine does not fit all.
Correct.
In conventional medicine, we always look at averages. And we treat people like herds.
Right.
Okay? That concept is no longer true. In fact, it's been blown out by evidence-based medicine. Just look at genomic testing has blown this theory out.
Exactly.
And I'm telling you what that means. That means that every person has their own individual genetic makeup, their own, what we call their own mutations, their own genetic makeup. So the era of personalized medicine is here.
Yes.
And the next step, which is another topic, I'm going to have to bring it back a couple of times because we'll talk about genomic testing and genomic medicine, right?
And the advances in genomic testing today is
because you
remarkable.
cannot change your genes, but the way you express your genes can be changed through nutrition. And so that's a whole different topic, but and nutrigenetics, nutrigenomics, again interrelated. But at this point is I wanted to really emphasize was that what really is the differences of functional medicine and conventional medicine. You know, I know you've written this book. It's a phenomenal book. I remember when I first started, and I know you've been in this longer than I have been, but this is Curing Cause and Preventing Disease. It's a series of CDs and DVDs that you've done, and it's really a great learning, great learning that all of us have gotten. I think people, whether it's be a doctor or a person who's not even in the medical field, can learn a lot from your book.
Right.
And so you've done a great job of doing it. I also know that you're the director and the head, you're the founder of the Advanced Medical Academy.
Yes.
And just briefly tell us, I know we're running out of time, but if you could just tell us.
Sure.
I know that your website is at advancedmedacademy.com. You teach doctors who want to learn this. That's basically your passion, is to teach doctors who want to learn and don't know where to go to try to learn this, right?
Right. The Advanced Med Academy was developed really in the need of my feelings that physicians need to be educated on what functional medicine is. And as more and more consumers are demanding something different, they need to know this information. And if they can't get that through their readings on the internet, we've provided online education for physicians, and we have physicians all over the world taking our courses.
I know you do. I'm supposed to be doing your hormone curriculum.
You are doing the hormone curriculum. Exactly.
I'm in the midst of developing
and many
it.
more, I hope.
yes, and the aesthetics, yes.
Right.
So, no, I look forward, and I think I'm so glad you were able to come on to the show. It was great having you. I really,
Thank you.
Just one thing before you leave.
Yes.
If you had to give one piece of advice to the audience, okay? I know it's just, but what would you tell them in terms of their health?
I would tell them to stop treating their disease. Their disease is an end stage, but rather find out what was the cause and treat the cause of the problem. That might require going to a different doctor, seeking out different types of help, taking different types of lifestyle management changes into their life, or whatever it might be. But we have to start looking at the cause of the problem instead of the end result.
And for those of people who already say, well, I've already got the disease, tell me what piece of advice you can give them.
Again, seek out a functional medicine practitioner such as yourself,
and yourself,
or an integrative medicine practitioner, whatever they want to call them. Find out what kind of education they've got. The other thing
they should have had a fellowship in functional medicine, serious functional medicine training. Any anti-aging regenerative physician, I think, that people seek out should have knowledge of functional medicine, have done definite training in it.
Right.
I'm board certified in anti-aging regenerative medicine. I think that's also a great qualification to have. So those are the things that you should.
One last thing that I would say is don't rely upon the internet. for your answers.
There you go.
We've
it.
seen the
I love
commercials.
it.
Well, I
Oh
saw it
my
on the
God,
internet. It's got to be true, right?
I love it. I love that.
So ask your doctor, and if they don't know the answer, then maybe that's not the right doctor for you.
That's it. Seek a doctor who knows about integrative medicine. Right. I think it's outdated for any doctor not to have knowledge about integrative medicine.
Absolutely.
We've got to keep up with the times, and this is what this show is all about. Thank you for having, for coming and actually for me having you on. Really, it's been, I always enjoy. I get into so many amazing conversations with you.
We do. Really enjoy it as well.
This is Dr. Naina. I'll see you next week. NainaMD, Fusion of Science and Beauty.